We'll start off with risk, and you'll see there's a little formula that I've got there. That really is shorthand. Don't think of that as a definition. It just helps us get to where we're going. And there's nuances around both the numerator and the denominator. So let's get into it. Risk really refers to the probability that an individual will develop a disease or a health outcome during a specified period of time. And it's expressed as a proportion, so between 0 and 1, or as a percentage between 0 and 100%. Now, if we look at the little diagram that I've got, and we'll build in the formula and talk about how to apply that. I've got 4 people, person 1, 2, 3, and 4, and years 1, 2, 3, and 4. So 4 years, 4 people. And person 1 comes into our time frame already sick. Right. So that blue little line there would not represent a new case, and so wouldn't contribute to the number of people that, the numerator, the number of people that got sick. Right. So that's the first thing I want to point out. It's new cases. If a person comes into the time frame with the disease, that incidence is not counted. The next thing to notice is that person 2 got sick twice. And how do we deal with that? And that depends a little bit on whether or not you are wanting to calculate what we call person-based risk or incidence-based risk. And usually we're talking about person-based risk. So unless otherwise specified, we're talking about the probability of a person getting sick in a particular time frame. So how would we interpret this diagram as it is at the moment? Well, of the 4 people that were at risk, 2 of them got sick. So the typical interpretation of this diagram with respect to risk is that 2 of the 4 people got sick and the risk was 50%. In other words, of those 4 people, there was a 50% chance for each of them that they would get sick in the 4 years that we're considering. Now, if we were talking about incident-based risk, we would say 75% because we would count the 2 occurrences of the disease in person 2. A couple of other just things to keep in mind. When we talk about risk, say it's the denominator is the people that are at risk at the beginning of the time period. But person 1 was sick at the beginning of the time period. And so strictly speaking, at that point in time, not really risk, depending on the disease, but for most diseases, not at risk of getting sick then because they were already sick with whatever disease we're talking about. Most diseases, you can only have it once at a time. In this case, we would still count person 1 in the denominator because they recovered from the illness and then continued to be at risk of getting sick during the rest of the 4 years. But this is where sort of subject matter expertise matters because there are some illnesses for which if you've had it at all, once you've recovered, you are not at risk of getting it again. So if it's a disease like that, person